talk about autism. In particular, I'm going to be talking about an umbrella general term, autism spectrum disorder. Autism is one of these categories where it has changed over time. It has evolved over time as we learned more about the symptoms, the experiences, the functioning that you see in individuals in this category. And so sometimes there is confusion with students with teaching because they may have family members, classmates that are diagnosed with autism, and they get a little confused because they've heard different words, or they thought they're familiar with older rules about who can be diagnosed with autism. So let's first establish that these rules, the diagnostic criteria, they have evolved, they have changed. And there have been indications that they're going to change again when they do a revision of the DSM, the Diagnostic and Statistical Manual of Mental Disorders. And it's always, when you're dealing with actual people, it is always tricky to capture human behavior effectively. And so one issue is that we used to have a lot of separate categories, separate specific disorders that were under this broad category of pervasive developmental disorders. And now we have kind of one broad label, ASD, autism spectrum disorder. And I catch myself doing it too. A lot of people would just say autism when technically they should be saying autism spectrum disorder. So this is any of several disorders or several, previously distinct disorders characterized by poor social understanding, impaired language, sometimes not learning language at all, other times being delayed or having difficulties with specific aspects of language, and unusual patterns of play or interests. All right, so poor social understanding. That can include things like not understanding body language, not understanding sarcasm, not understanding when people want to play with you or when they're trying to be nice to you, not understanding emotions. Also, in some cases, you have sort of more severe manifestations of autism spectrum disorder. You might have some individuals that they don't seem to be social at all. They kind of are very isolated, kind of living in their own social bubble. They don't really interact with others. It's a spectrum. There's a whole variety of behaviors that you can see. Also, the unusual patterns of play or interests. You might see repetitive behaviors, spinning or self-stimulation, flapping arms. There's a whole, if you want to know more, I'm going to link to some additional videos. If you want to know more, there's lots of information out there. There are a lot of websites and such. Autism is such a rich, diverse community that it's really hard to capture what sorts of things can count. And this is actually one thing that's happening on social media lately, is a lot of adults are going into their doctors, their health professionals, and saying, I read some stuff online, I saw a video on YouTube or TikTok, and I think I might have autism, even though I never suspected that, because in my day you had to have much more severe symptoms to be diagnosed with autism, but I think I might have that. Things in my life that always made sense to me, but other people didn't necessarily do. I'm now finding out that they could be a sign of autism, and then sometimes they get evaluated like, oh, actually you do. You meet the diagnostic criteria for autism spectrum disorder. And there is a lot of controversy about the current trend of self-diagnosis. Some people are like, no, that's not valid. But a lot of people who are doing this are going to medical professionals, sharing their thoughts, and the medical professionals are saying, oh yeah, actually, yeah, that works. That you're right. There are controversies, there are cautions, obviously, with self-diagnosis, but that doesn't mean it never happens. It never happens in a valid manner. So there are a variety of things, but and I should also mention that sometimes students will say, well, okay, you're describing autism spectrum disorder, but isn't there another one called Asperger's disorder? Well, it's all autism spectrum disorder now, but we used to have a separate category for Asperger's disorder, which was supposed to be kind of your more higher functioning, less impaired category. It was problematic the way that it was used. All right, high functioning is a tricky, problematic term, and so we try to get away from that term. And another issue with Asperger's is it's named for a person named Asperger, who was a Nazi, and the reason he wanted a separate category is like he thought the people with the Asperger's type symptoms were like more worthy of being allowed to live, and that we can maybe get something from their skills. Icky ideas, icky thoughts, and so a lot of people want to distance themselves from that term Asperger's. Some don't. All right, so if you want to say that you have Asperger's, I'm not saying you can't do that, but if you hear people having issues with it, it's usually, for those reasons. And so individuals with Asperger's type, the individuals who it's entirely possible that they are out there working independently, possibly living independently, possibly still needing supervision, but they typically are more verbal. And one thing that you'll see, though, is they have confusion in their social relationships. Like they might try to make friends and not realize they're offending their friends because they don't pick up on social cues. They might try to have a romantic partner and not realize that they're constantly talking about themselves and that they're supposed to stop and let their partner take a turn and talk talk about what's going on in their day. They often also have interests, obsessions. They will get into something and really get into something. And sometimes they will not be interested in much of anything else. A good way that I heard one parent describe it, it's like if it's interesting to them, they're going to learn all about it. If it's not interesting to them, and in this one case, they were talking about the fact that their child simply will not learn their phone number, which is a safety thing. I have that issue. By the way, I have a child with autism. And as we like to say, we're neurodivergent AF in my family. I'm the weirdo, so I went into psychology, But, so yeah, we had a lot of neurodivergent diagnoses and categories all throughout my family. So my child with autism, they're like, why do I care about phone numbers? But this other parent was talking about how their child can memorize all the facts and all the years for the stuff that they're interested in, but for their phone number, they can't be bothered. And so, that is something you can see. Also, with playing with toys, you can also see someone with autism spectrum disorder. They might prefer to play by themselves rather than playing with other people. Other people are really confusing to figure out. And they might do something like instead of, they might take dolls, and instead of acting out scenes with the dolls, they will organize the dolls. I had one client at one of the hospitals where I worked. He would take the Jenga blocks, the long, skinny Jenga blocks, and we had colored Jenga blocks. And he would take them out of the jar and he'd sort them by color. And they're like, "Do you want to play Jenga?" He's like, "I just did what you should do with Jenga. It makes perfect sense." Play will look different. Play will look different than it does for what we would say neurotypical children. All right, so what causes autism? As addressed in a previous video, not vaccines. So what does? We're not there yet of knowing exactly what causes autism. The cause and the treatment are still very much disputed. We're still figuring out what we're doing with autism. There is no single gene that causes the disorder. Based on current research, we have not identified a single gene, but we suspect there are genetic influences. Some genetic factors are probably at play, especially when you look at families where, like my family, where you have multiple family members who have autism spectrum disorder. We wonder if it's about the neurons, like the number of neurons, the number of synapses. It could be linked to birth complications, prenatal injury. Some people have suggested chemicals during fetal or infant development, but we don't have any suspect chemicals. And then, some people think that family environment, it's not like it causes autism, but it might contribute to the manifestation. I mean, there's lots of things have been suggested. Lots of things are being researched, and we have to wait until these studies give us more insight into what could possibly be causing autism. A lot of people think that autism is a good example of something that has equifinality. Equifinality is the idea that a particular syndrome, a particular disorder, a particular set of behaviors can have multiple causes or multiple pathways to the same diagnosis. It may not be only one cause, so that makes it more complicated to conduct research and figure out what the cause is. It may be the possible causes. All right. Let's see. Okay, most are diagnosed at age 4 or later. One of the earliest signs is language issues. One issue is when a child does have language delay or lack of attempts to produce language, attempts to communicate. That can be an early sign, but a lot of behaviors, if you don't know what you're looking for, a lot of the behaviors may not be caught right away. We used to say that a big symptom of autism was problems with eye contact. The problem is we now know that although some individuals with autism have a lot of difficulty looking you straight in the eye, not everybody has eye contact problems, and so now that's lower on the list. And that's actually something that affected my son. My son was not diagnosed until he was 9, and one of the issues is when I brought it up very early on in his life in preschool, the person I spoke to, they're like, but he makes really great eye contact. They had the older, they were thinking of the older writings, and they had been influenced by that. So you can make eye contact. We now know that some folks with autism spectrum disorder, they manage to do eye contact, but they do the other things. They have the social understanding difficulties. They have the stereotype, repetitive, quirky, obsessive interests. They have the possible communication difficulties. And then the other thing is that boys are more likely to be diagnosed with autism than girls. We are starting to recognize more cases of girls than boys, but it is still more likely to be diagnosed in boys. And I worry that they're going to change it soon, but right now there are categories. It's level 1, level 2, and level 3 autism, which are supposed to roughly correspond to mild, moderate, and severe autism. Some people are finding that the utility of the system can be troublesome, but that's what we have right now. And so I do have some video. I will link to one video that talks about what are these levels: level 1, level 2, level 3. What does that mean if somebody uses those terms? Now, what sort of treatment may be needed for someone with autism? It very much depends on the individual. Some individuals don't become verbal. So going to school, going to regular classes, if they do go to inclusive classes where they are in the same class as neurotypical children, they may have like a one-to-one aide, someone to sit with them. They might be allowed to get up and spin and things that, that may be part of their symptoms, part of their behavior. Other individuals may need some special counseling, special classes to work on social skills and language. Speech therapy is a very common thing that individuals will get. My son does get speech therapy, and ever since he's been diagnosed with autism, the main focus has been on pragmatics, the practical aspects of speech. Because at first he did have some problems with pronunciation, and now he pronounces things mostly fine, where you understand what he's saying, but he makes mistakes like in a conversation, when's it your turn to talk? They will do role play, because I remember when he had to do speech through Zoom, through online during the pandemic, I got to overhear some of his sessions, and they'll do simple things like, okay, you're having a conversation with somebody. They just mentioned where they went to eat dinner. So what should you say next? And he would just sit there and be like, well, I don't know, I'm done. They say, why don't you ask them what they had for dinner? And he'd be like, oh, I guess I could do that. And then they name some dish that he's never heard of. They're like, oh, have you ever heard of that dish? No, I don't know what that is. So how can you learn what that dish is? And of course, the answer is you ask the person, but my son would say, oh, I could Google it. So they would just teach him things like, oh, you can ask the person to learn more. Trying to teach him how to have a conversation. And it has helped. And also teaching him things like how much people appreciate when you thank them, because it didn't occur to him that people would like that. Theory of mind is not quite the same for someone with autism. They have difficulty reading someone else's mind, figuring out what someone else's thoughts and feelings and wants are. They can get really good with help, with training, with skills education, but they very often need that. And some individuals, depending on their cognitive skills, some individuals will do very well in school, others will struggle. Some can go to college. At my campus, I know I have had students who have identified to me as being diagnosed with autism spectrum disorder. Sometimes their struggles at campus are not academic. They are more along the lines of, I'm not sure how to act in class, or I got confused by these directions. But I understood the concepts, but the directions confused me for something. So various levels of functioning can be seen, various specific symptoms can be seen, various levels of treatment may be needed, and for some individuals, they may never be able to live independently. For others, they may be able to live somewhat independently, like they may be able to have their own apartment. Some will go ahead and get married, have their relationships with support. Others may need supervision just for those little things, like for the person who is capable of memorizing lots of stuff, but they still don't bother learning a phone number. You may need to check up on them. Check up that. Are you going to your appointments? Are you feeding yourself? Things like that. All right. So if you want to know more, there's so much more to be learned. I will link to that additional information, and you can ask questions. When I say ask questions where it's clarification, not ask questions where it's like, so why should I even trust you about these things? Because sometimes I will get the interesting comments or questions where people want me to defend the field of psychology, which, folks, I can't do that. I'm teaching you the definitions that are in the book. All right. Okay, so this is my last video about students with special needs. There are other needs out there. I have covered the big ones. All right. So it's not, I didn't cover depression and anxiety. I'm going to cover that when I talk about some later age periods. There are other disorders, other diagnoses out there. I talked about ones that would be particularly relevant during middle childhood, but there are some others to be covered in the future, and others I won't be able to cover because of lack of time. But this is the end of the developmental psychopathology stuff.